I'm Dr. Balamurugan, consultant pulmonologist from Chennai. Today I'm going to discuss with you regarding sleep apnea. What is sleep apnea? What are the types? How do we diagnose and how do we treat this particular condition? Sleep apnea is a sleep disorder in which condition your sleep gets fragmented. Means because of loud snoring, the sleep gets interrupted. So you keep awakening from the sleep on and off, and because of this problem, your sleep is disrupted, and in the mornings you have typical symptoms. Now, what is the basic reason of this? Before that, there are three types of sleep apnea. One is the most common type is the obstructive sleep apnea. The second most common is the central sleep apnea, and then is a complex one. Obstructive sleep apnea is the most common thing. In this condition, the muscles and the soft tissue surrounding your airway or the upper airway, they relax, and then they cause the compression of the airway that results in snoring and then sleep apnea. The second type is central apnea. In this central apnea, the brain, which generally sends signals to the respiratory muscles to breathe, does not send that particular signal, and because of that, the patient has problems of sleeping. That causes this can be termed as a central sleep apnea. And then the third one is a complex sleep apnea. This can be considered as a mixture of both obstructive and central. So generally, if the patients they have an obstructive sleep apnea and a central apnea, when we treat the patient for an obstructive apnea that gets converted to a central apnea, the symptoms predominate. So this is called as a complex sleep apnea. Now what happens? What are the basic symptoms? The first and foremost symptom is the snoring. Generally, snoring occurs because of heavy snoring, the sleep gets disturbed. And generally, the patients they do not sense snoring. It's being done by the spouse or the other partner, like heavy snoring. That is the first one. Second thing is the main differentiating feature from the central and the obstructive sleep apnea is the patient fights for breath. This is called as an apnea. After a certain point of heavy snoring, the patient stops breathing. That is called as a hypopnea, and then it goes in for a complete cessation of breathing. This is called as an apnea. After a certain period of time, the patient starts breathing once again, and then the snoring starts, and this cycle can occur more than 30 per hour also. Now, in case of central apnea, there is no respiratory breathing pattern at all in the patient. That is a basic differentiating feature between these two types of sleep apneas. Now, what are the basic symptoms of that? The first thing is, apart from snoring, because of the disrupted sleep in the night, as soon as the patient gets up in the morning, they feel some sort of an unrefreshed sleep. One thing. Second thing, there could be a morning headache because of disrupted sleep. The third thing is, because of the disrupted sleep in the night, that tends to be compromised in the morning with an excessive daytime sedation, sleepiness. Because of this, the patients might not be able to concentrate on their work. They become hyper irritable. Sometimes the patients do not have a proper sleep. We call it as an insomnia, or because of excessive sedation in the morning, which is called as a hypersomnia. All these symptoms predominantly occur. And not only that, patients with sleep apnea, there are certain high-risk patients, like patients suffering from certain medical conditions like uncontrolled hypertension, diabetes, cardiac problems. All are more prone for sleep apneas, and uncontrolled and untreated sleep apnea might result in any of these conditions like diabetes, cardiac problems, hypertension, lots of other problems including liver and other problems. So these are the basic symptoms and complications. How do we diagnose a patient with sleep apnea? Apart from the history, the basic thing is if we suspect a patient to have an obstructive sleep apnea based on the symptoms like snoring, excessive daytime sedation and all this stuff, we subject the patient for certain investigations called as sleep testing. There are 2 or 3 levels of sleep testing, which includes a complete sleep testing called as a polysomnography, and then there is a limited sleep testing also, which we call it as an overnight sleep study. We take the cutoff as apnea-hypopnea index, which normally usually less than 5 per hour, and as I told, it might be mild, moderate or severe depending upon the number of apneic or hypopneic episodes per hour. So once we diagnose the patients as having sleep apnea, we try to treat the patient apart from lifestyle modification. One important thing what all the sleep apnea patients should identify this is lifestyle modifications. As I previously told, risk factors include alcohol intake and heavy smoking. So all these habits should be stopped at the maximum. Number one. Number two, there should be a proper sleep hygiene, and those patients who are not able to have a good sleep, once they go ahead with a good sleep hygiene, most of the patients they become okay. Apart from lifestyle modifications like weight reduction and all, specific depending on the apnea hypopnea index. If the apnea hypopnea index is very high, we tried, as I told you, the muscles relax and then cause a constriction of the airway inlet. We need to dilate this. We can go with some machines called as CPAP machines, the continuous positive airway pressure. Most of the patients who have been diagnosed with this condition try to get this particular machine. It delivers a positive airway pressure continuously, acting as a sort of a pneumatic splint, so that the airway is kept always open, causing the muscles to relax, and then the inlet is open. The patients do not have snoring and then the sleep apnea. So these are all the basic types of treatment as far as the sleep apnea is concerned. Most of the patients with sleep apnea, especially obstructive sleep apnea, once the lifestyle modification occurs, they stop alcoholism, and then they try to stop their smoking. And apart from sleep hygiene and then the CPAP, they become better with the quality of life becomes greatly improved. Central sleep apnea is a totally different condition that we can discuss sometime later. Thank you.